I'm going to share with you some very important principles as to how to understand disease presentation as you're seeing it at the moment. A lot of people around you are sick. You may be sick yourself, and you have no idea why, and no one seems to understand what's going on with you. The reality is, if you don't understand what has happened in the pandemic, none of this will make sense. But the truth is, nobody wants to talk about it anymore. They want it to be behind them. And so I'm going to be sharing with you some very, very important information with regards to a paper that has just recently been produced, small fiber neuropathy following COVID-19 vaccination. The minute that you mention that, straight away, the information gets suppressed. And this is why very few people are able to see these videos. So if you're watching, make sure that you like, make a comment, and subscribe. So I'll be taking you through that paper and I'll be sharing with you how I think it correlates because even though they have seen it, they don't understand why. And I'll be explaining that. For anybody who is interested to understand about the heart related predictions, COVID heart storm is coming up in just a few days. Please make sure this is exceptionally important. And again, it is something that you're unlikely to hear much about. So please make sure you join me to understand the science of what is going on. So let's get back to what it was that I was sharing with you about this neuropathy. Many people don't even know what it is that we're talking about. So here is the paper that had recently been published. Small fiber neuropathy following COVID vaccination, a case series. Now, this was only published this month, and essentially, I'll be explaining a bit more about small fiber neuropathy. And this was about symptoms primarily in the skin related nervous system. And it wasn't a big paper. They looked at 16 patients that they found that they diagnosed nine of with small fiber neuropathy. So straight away, some people will discount this and say this is not a lot of patients. The point is that this is a trend. Getting a formal diagnosis is not so easy. And critically, the time frame is not normally necessarily equivalent. In this case, or in these cases, there was a very clear temporal connection between vaccination and the onset of symptoms. Now, for anybody who has been following me, you would realize that I've always been talking about this COVID storm. The COVID storm, in my view, a spike triggered autoimmune response mechanism, means that once the immune system is primed, once exposed to further spike protein from infection or otherwise, it can trigger a whole range of diseases. That's the premise of the COVID storm. So, my point here is not that people were diagnosed with this within about 30 days of them being vaccinated. The question is the people who then have symptoms 2 months after, or 5 months, or 10 months, can it be the same mechanism? And usually, once it occurs, once you have clear evidence that it is occurring, it just depends on the individual patient as to when it will present. And so, when you look at classically what happens with regards to this small fiber neuropathy, it's often dominated by neuropathic pain and autonomic complaints, leading to a significant reduction in quality of life. The thing about neuropathic pain is that normal pain relief does not work for it because it's not actually pain in the muscle or the joints, it's in the nerves. And I'll explain to you how this works in the context of the skin. It really is debilitating. For patients who have neuropathic pain, say after a stroke, it can be literally the worst pain because it is continuous, boring, it's permanent, it just keeps on going, it doesn't stop. It's actually terrible. And so we need to find ways to understand who is affected. And the reality is that because of spike exposure through this pandemic, this is likely to be a huge problem for which many people have no idea. So let's take you through the science so that you can understand a little bit about what exactly it is. Then we'll come back to the paper. And so let's take a look at what happens in the skin. And this is oftentimes where this is relevant. And this is specifically what they looked at in the study. So, what you have to understand is that the skin has a nervous system. And you can see here that this represents the surface layer of the skin, the epidermis. That's what you can see. You can see the little hairs sticking out of it. And then you have sweat glands in there. But you must look carefully underneath here, and where you see white are different kinds of nerves. Some of them are about pressure, some of them are about temperature, some of them are about pain, some of them are about vibration. In the context of what we are looking for the fibers that are the C fibers, open ended fibers, and these A fibers, open ended, where they end up in the skin. And these are oftentimes about pain, temperature, and so on. Very, very important. And this mechanism is what helps you to know what's going on around you. That's how you feel the clothes on your body. If you just imagine that you're wearing a top now, imagine that your skin was sending too many signals to the brain. That shirt or blouse would be painful. And so the skin nervous system is exceptionally important. And then when you look at the kinds of things that it has or it senses, some of them, as I said, the mycinous corpuscle, light touch and texture, Merkel discs, find sustained pressure. Say, for instance, if you are trying to feel a key with your eyes closed, this is what would help you to know what it is. The Pacinian corpuscle, this is about vibration. So if you put your phone on your knee, you would feel it vibrating. And then you have other roughening endings, which is about stretch of the skin and grip control. But the free nerve endings, which I've highlighted here, the C fibers and the A fibers here, pain, temperature, and itch. This is what is very important and what seems to have been affected primarily in this context. What they were looking at in the paper is nerve loss in the skin. So they took a skin biopsy, and this is the kind of thing it would look like. And this is from a paper comparing diabetic neuropathies, but the principle is the same. Over here, you have the control, and you can see the nerves in the skin. And here is somebody with metabolic syndrome, and you will notice that they're far less in the skin, and similarly with diabetes, lower here than even metabolic syndrome. And in this situation, this is how you can make a clear diagnosis that these nerve endings have been damaged. And this is technically the diagnosis. Intraepidermal nerve fiber loss is what they were looking at in the context of the paper. And so I'm going to take you back to the paper, and I'm going to help you to understand a little bit more about what exactly they were talking about. So, as I said, the main symptoms are to do with neuropathic pain. And as they said, want to show you this here. The clinical findings in these patients, 88% of them described burning and tingling that has been going on for a long time. When you look at the breakdown of the general information that they looked at the patients 1 to 16, their gender. Most of them were female. You can see in terms of their age here, that they're usually at, there's only one person here who is 28, but most are above 40, another person 27 here. And time to onset of these symptoms, in this person, it was only 1 day after they were vaccinated, 7 days. This one was on the first day, up to 30 days. But the majority are within 1 week. One person here is 9 days. The vaccination dose, you could see that it was Pfizer, AstraZeneca, mostly Pfizer, one Moderna. This indicates largely that it can be caused by any production of the spike protein. Most of these patients had comorbidities, as you can see: rheumatoid arthritis, osteoporosis, sarcoidosis. So they already have underlying conditions that could put them at risk for these kinds of patterns. It's important to note that only 9 of these 16 were formally confirmed to have vaccine induced damage. Now, as I said to people before, it's not easy to make that kind of diagnosis. And the fact is that if you don't have an underlying condition like diabetes or metabolic syndrome or some other neuropathy, if you have these new symptoms, it's very difficult when we have clear information from the research that this can occur. It's very difficult for people to say it was not relevant or it wasn't connected. That's a different story. When we look carefully at the kinds of symptoms people had, they had burning, that sleeping, burning sensation. You'll notice that everybody had this burning sensation, tingling, burning, burning pain. It was affecting the sleep all the way through. That's what they found. But not everybody had changes in their sensory, decreased touch, pinprick, so they were testing all of these patients to see if there was anything abnormal. And if you notice this patient 6, they had burning and tingling, but they had normal sensory, normal muscle, normal reflexes, but their symptoms were still there. And this is the reality of what was happening to these patients. And this is the reality of what is going on all the time. So let's get back to what I think is the mechanism for why this is happening and my thoughts as to how we need to approach this in the future. So, when we look at the premise, you have to remember that based on my research, everything is about the spike protein. So we start off with that. The spike protein on the surface of the virus, there are about 25 of these. They're trimeric. That means that every single one of these little bumps can bind to ACE2 and it enters a cell. And this is the side-on view of it. This is the base that would be where it's sitting in the viral envelope. So this is the basis of all the problems around around the pandemic. This spike protein. What you have to know is that this spike protein is like Velcro. It sticks to multiple other proteins. One of them is ACE2, but there's also furin, neuropilin 1, DC sign, the estrogen receptor binds to it down here. You have hemoglobin. It is like it sticks to so many normal proteins that this spike protein can trigger autoimmune responses, because once a protein has bound to it, how is the body going to differentiate the spike protein from a normal protein? It then gets very complicated. And this is one of the main mechanisms with regards to autoimmune characteristics. And so, therefore, if you have that process occurring, if it doesn't necessarily happen with everyone, we still don't know necessarily who it will occur with, but if that happens, this is my prediction. In this case, this was free ACE2 binding to the spike protein after vaccination, but it could also be neuropilin 1, could also be DC sign or CD147, could also be furin, it could also be hemoglobin beta, it could also be platelet activating factor 4. Whichever one binds to the spike protein, when it is then processed by the immune system, will trigger an autoimmune response. That's been the essence of what I've been saying from the start. And this is why we have to be careful with exposure to the spike protein. So now let's get back to the skin, because how is this connected with what patients are feeling with these unusual pains that they have all the time? Here you have again the skin with the nervous system, and it shows you the hairs. This is the pores and the little muscle hair to make your hair stand on end. This is glands that help to produce the oil to protect your skin. So, all of this, and in yellow, you have all of the different nerves in the skin, and they all have different functions. Some of them control the blood vessels, some of them control the amount of sweating, some of them will control the sensation, like these here. And these are the ones that we think are involved, these small, unmyelinated fibers in the skin that pick up specific sensations are primarily affected. And what I've realized is that these ones that are unmyelinated are especially vulnerable if there are autoimmune responses to neuropilin 1. And when we look a little bit closely, you can see here and this here, these fibers can then get targeted and inflammation can occur around them. And what you can end up with is damage to them, where you have decreased sensation, but even more importantly, if they get continually stimulated by inflammation, they will cause pain. That's a critical factor with what is going on. And so this may explain why so many people have so much chronic pain. How do you know if you may be affected by this? Well, there are certain factors that could be explanatory. Here we have, you may find that there is sweating abnormalities in the skin, where you have little or no sweating with dry skin. But these are usually new problems, or you have excessive sweating. This normally points to autonomic damage in the skin. How about temperature dysregulation? Cold skin gets flushed, gets red and blue depending on the temperature. Color changes with mottling of the skin, sometimes redness, irregular patterns. The skin, in terms of the hairs, don't stand up with goosebumps. This again indicates there is a problem with the innervation of the hair glands. And then the skin integrity, it's dry, it's itching, it's burning. And this is again directly related to the nervous fibers. All of these things are potentially happening to a lot of people, and they have no idea why. And nobody seems to be able to explain what is going on. And so, when it comes to this principle about autoimmunity, someone may say, well, actually, we don't know if that's necessarily connected. But in the context of the paper, they did address it. Autoimmunity and molecular mimicry are also investigated in immune mediated neuropathies. And they highlighted the correlation between autoantibodies in COVID and the antiviral humoral responses, showing that the presence of autoantibodies in COVID correlated with increased antiviral immune response and inflammatory immune signatures. This just tells you that autoimmunity is a critical part of it. And the critical piece of the puzzle, as I said, is neuropilin 1. This is a big issue because, as I explained to people, is that the diagnosis is not easy to make. And you can see here, even from the paper, that when they looked at the cases here in terms of the diagnosis, patient 1 is definite, patient 2 is probable, patient 3 is no. And that's largely because all the tests were normal. What I would say is that if that person did not have neuropathy or diabetes or some other condition, it was probably still related. But it shows you how hard it is to get a definitive diagnosis, even when, just remember, every single one of these patients, all 16 patients, had new symptoms within 30 days of being vaccinated, never had it before. And of that, only 9 were considered to be related to the vaccine. Imagine if your symptoms were 5 months down the line. This is the problem. And what I'm highlighting based on autoimmune principles, based on the storm, means that we are likely to see this more and more as the virus continues to circulate. Less and less people are being poked. And so that's one aspect that is reduced. But if the immune system is primed, they could still be quite seriously affected in the longer term. This is just part of the process, part of understanding as to what's going on. And as I told you before, this information is being significantly suppressed. You don't know how much. Very few people are seeing this now. And therefore, you have to take this information and try and pass it on to others. Let them watch the video. Remember as well to join me in more information as I look at the heart storm, uncover the secret scars on the heart. Most of the population just want to move on from COVID. They don't want to hear about it anymore. The problem is the manifestations are still there. And if we don't look at it, you're going to be left suffering with the symptoms and no chance of recovery. We've got to find ways to have this conversation and do the science. Have a great evening.